Yeah, Glenda, it's not just hospitalizations and cases that are on the rise. It's also the number of variants as the state continues to push out more vaccines to keep up.
It's absolutely a race against the variants.
Vaccines versus the variants. So far, nearly 2.5 million Michiganders have had at least one dose of vaccine, but cases are starting to climb, and hospitalizations are up 50% since last week.
Our assumption is that many, if not most of these are the variant, which we know is significantly more transmissible.
Across the state, there are now more than 1,000 confirmed cases of variants, the vast majority of them the UK strain. Wayne County has the most with 78, then Washtenaw County with 75. Both Macomb County and Oakland County have less than 35.
We do know that the variant is present. It is more transmissible, which makes those mitigation measures even more important.
State Health Director Elizabeth Hertel says despite this, there are no discussions to tighten restrictions, but some schools are making their own call. This week, Utica Eisenhower went full virtual through mid-April, with more than 400 students now in quarantine from 40 cases.
The cases in school do seem to be coming from outside events, whether those are athletic events or other extracurricular activities.
This week, roughly 65 new schools were added to the state's school outbreak list, as people 30 and under are making up most of the new cases, an age group less likely to be hospitalized, but more cases means more spread and more variants to deal with.
As we move forward, I do have concerns about how much we're seeing COVID transmission among children, because every time the virus does transmit to another person, it gives an opportunity to mutate.
Now, that rise in hospitalizations is mostly seen in the 50-year-old age group, as those 65 and older, the majority of those have now been vaccinated. Reporting here live, I'm Brett Cast, 7 Action News.